Hello, guys,
Hi.
and welcome back to our YouTube channel, Sisterly Conversations. So, without further ado, topic. All about being a nurse. Best topic in the world.
Oh, shoot. Okay, so my sister here is, well, actually, let me not see. I mean, we kind of said it already, but I will ask her some questions and she will give us the answer to these questions so that you can learn more about her career. Okay, so the first question is, what is your occupational title at this point?
I am a registered nurse. Get your life.
Very short and sweet.
Very short and sweet.
Okay, what made you decide to become a nurse?
Well, to be honest, I wanted to be a mortician. And then I said, I think I could actually make people laugh, and I can't make the dead laugh. So I think it's better for me to become a healthcare provider who would make people smile, and that's how my thought about being a nurse came alive. And I really love people, so that's one of the other reasons why I wanted to be a nurse.
Yes, I believe that someone that's a nurse needs to be very compassionate. They need to be very kind, loving, and I'm speaking from the position of a patient where I had my own experiences where I had to be in the hospital several times. That would be another topic for another day. I suffered from endometriosis, a very rare and severe form of endometriosis, and I spent a good long time I spent a good long time in the hospital. I know this is all about Tony's journey, but I just wanted to put in that part. So my observation of a nurse would be somebody who is compassionate, somebody who is kind, somebody who's loving, and somebody who has good bedside manner. You want somebody that is, vulnerable to your or understanding to your vulnerable state, because anyone that's in the hospital is in a state of vulnerability, and that they need that support. So
Okay, back to
that,
me now. Back
that's
to me now.
that is a good reason why you decided
But
to.
it's
My
good.
sister is very loving, caring. She treats people with respect, and I think that was the perfect career for her too, because it showcased, along with the other side of nursing, it definitely showcased those characteristics for her. Okay, so the next question is, what was the process of becoming an RN in Barbados?
Okay, so in Barbados, you had to apply to the Barbados Community College for the BSN RN program, which is a 4-year degree. So you do the subjects that are required of you to do. Then you do a practical exam, two critical care exams, and then you pass college. From passing college, you have to be entered for the regionals examination of nursing registration, and then you have to, once you pass that examination, and you only have 3 chances. Once you pass that examination, you will now be a registered nurse in Barbados, and you will sign up under the Nursing Council of Barbados.
Okay, so after hearing all of that, can you be a little bit more specific about, like, in terms of college, like what you had to do, like, for example, like what are some of the topics, and in terms of also the placements, like did you have to do placements from your like first year to your fourth year, or was it just like from your fourth year? So
Okay, so well, I have to speak from my year because things have changed recently. So when I was in first year,
what year was that?
2015. 2015 to 2016 was my first year. We did not go into the clinical area. Back in the day, they used to go in from as early as the first year, but now they don't, at least when I was there. Um, but we did do clinicals at the school. So we dealt with like dummies, we dealt with each other, and learned this and started with these skills. So then in my second year, we would have done some subjects like anatomy and physiology, um, adult nursing, just to name a few. And then we were going to the hospital. So I went into the med surge um, floors at the QEH. I did um, urology. That's like that's more so for men who have like um, what is it called it now? Like prostate issues or any urinary issues. But it was mostly a male ward. I went to the trauma ward. I went to the surgical floor. I dealt with dressings and stuff like that. I went to labor and delivery, maternity, all of those within those other years, the third and fourth year. So I really started my clinicals from second year, first semester till fourth year.
Okay.
And just by the way, back in the day, it was an associate's degree. My year, 2015 to 2019, we were the first cohort to do the bachelor's degree, the 4-year one at Barbados Community College. Just wanted to say that.
Congrats.
I'm a part of history. Get your life.
Congrats to you, my
Thank
sister.
you. And I graduated with honors too.
Okay, so the next question is, what is the process for becoming an RN in Canada as an IEN?
So IEN stands for International Educated Nurse. So um, when I first decided that I wanted to move to Canada with my sister over here, I had to do something called the NNAS. I can't remember the first N, but I'll just tell you what it is. It is an assessment board that basically looks at your nursing program. They look at your verification of registration, and they deal with your education and I think your employment. So they would have assessed everything, and it's actually based in America. And then you would just send your application for whichever college you want. So a college is like for a different a regulatory board. Yeah. So I wanted Ontario, so I applied for the Colleges of Nurses of Ontario, right? So once they do that, now it's supposed they say 3 months, but it's actually a year. And if you don't get behind them, it will take you longer. NNAS. So once they do your paperwork, they will say if it's compatible, somewhat compatible, or not compatible. So after that, when you get that report is automatically sent to the CNO or your regulatory board that you want in nursing for whichever province. And then you have to pay money to start the registration process. CNO will tell you if you have to go and do courses or if you have eligibility now to write the NCLEX exam. Um, so that's what they do. But for me, when I came to Canada because of the COVID situation, they needed nurses really bad. So they gave the international nurses temporary license. So that's what I was working under during that time or whatever. So now, after 2 years, then you have to make sure that you do your general meeting requirements, and then you'll be able to have eligibility for the RN. I mean, to write the RN and class exam. Yeah.
Okay.
So I just wanted to add to um, it would be too much money to also go back to school at the time because sometimes these classes were like $450, and this is 5 classes from me that I had to redo, and I went through the road of America, but now Canada is I'm sorry, Ontario is now finishing with that as of April 1st. So before, if you wrote the NCLEX exam for either America or Australia, then you would be able to transfer it to CNO. But now that CNO is making it much easier now, they are going to finish with that as of April 1st this year.
So, in terms of CNO now, what is the process now for international educated nurses to, since CNO is now making these changes for April 1st, what would an international educated nurse that's coming now, what would they have to do?
Okay, so once again, you will have to do the NNAS for CNO, and then CNO will see your education, your degree for nursing, whether it be associates or bachelors. When you do that, they would now um, make your education requirement now met on their profile thingy. So then you have to now do a course. I think it's for 30 hours. So maybe like a week. You could do the course. Um, it's like a transitional course whereby you go from your place now to up here. So I guess you will get to learn, different the Canadian health system. And then from there you will then get eligibility to write the exam. But you have to show proof that you did the course that they want you to do. Okay. So that's how they do it now. Yeah, as of April 1st.
Okay, so what was your worst experience as a nurse? Or instead of worst, maybe what was your most challenging experience as a nurse?
Well, at the time I wasn't really a nurse, but I still was I was a nurse back home, but not out here. But the worst experience I can say is seeing my sister in the hospital bed. I was not her nurse, but it was the most challenging for me in my career. If y'all understand what I'm saying, I wasn't working at the time. But yeah, you might see people in a bed, and yes, you can show compassion or whatever. But when it's a family member, I would say that's the worst experience in my career that I have seen in my life is seeing my sister in a hospital bed.
Yeah,
Yes.
We had a lot of those. My sister was very emotional, even more emotional than me, who was going through the actual experience. But I guess for her, like she said, it was difficult seeing me in that position. Okay, so what was your best experience as a nurse?
Well, my best experience as a nurse is seeing my patients get back well. If that's good English, I don't think so. But I like to see that if I see my patient is in distress or is having issues, and I do the interventions that I know I'm supposed to do, and I see them better and they look better, that makes my day because I know that I have done my job. And as I would have said in the previous, video, nursing is not only physicality, it is holistic, and we as nurses have to show compassion to patients and know that it could be one of our family members, and the way that you want your family member to be treated, you must be treating those patients.
Yeah, very much so. I agree. One of the other questions, I don't have it written down, but it just came into my head. Now, in our country of Barbados, hear me, like our country of Barbados, we have had a serious issue. We've had some complaints where the nurses um, have been so not being very, like, courteous, and or having customer service or so on with some patients. But however, the nurses have also complained about not having, like, or being treated as well, um, maybe in terms of finances, maybe in terms of stress, workplace stress, maybe in terms also of a management issue. I don't know. So what would be your thoughts on that situation as well? Like for example, despite having issues at work, um, what I really want to say is like, what are your thoughts about persons taking it out on their patients and so on?
Okay, so I'm gonna try to answer this as fairly as possible. Um, as a nurse, sometimes it might not be so much the patient, it might be management. Management would make decisions that would not make sense to us. And sometimes we are humans at the end of the day, so if our frustrations might go on the patient, it might be a case that you are so frustrated that you just do what you gotta do and come on home. I don't agree that we should do that, but it is still in human nature. We still have the same flesh as the patients. We have blood running through our veins and we have feelings. Sometimes too, the patients can be very rude and disrespectful. There are some people that will just curse you for no apparent reason. They carry on with you. They will snap at you. And let's say, for example, the nurse can take somebody snapping at them and they snap back at the person. They ain't gonna hear how unmanly the nurse is. I'm just being real. I was in those kind of predicaments. But at the same token, we still have to be professionals and we still have to know that when when it's we have to know when it's time to walk away. It's not every cockfight that you have to attend. If it is that the patient is being agitated or being rude or the family members are being rude, you simply tell them straight, I'm not tolerating this behavior, and you walk away. Because it's better that you save your license than you get in trouble and then they're living their best life and you know hurting your head either behind jail bars or you have no more license to work and you gotta find a new job. So it's better sometimes to just walk away. But there are other times, especially I'll be honest, in the Caribbean, some nurses just, the manliness just goes to the patient. But there must be a level of self-control in those situations.
Well, it's good to hear your perspective as a nurse because I've never had healthcare in Barbados. All of my healthcare have been in Canada, and I have to say that I really have no real complaints for the nurses that I've dealt with. They've always been compassionate, friendly, understanding, loving, caring. I can't say anything else about them, but I've heard a lot of horror stories sometimes in Barbados. But what I do in terms of like the nursing, I do have to say I did have a experience in Barbados with nurses, and they were the Cuban nurses and some Bajan nurses as well. And my experience too was also a great one. So I can't really say that enough experience on mannerly nurses, so to speak. But I think as a patient, I believe that whether it's you are a family member or whatever, this is a very vulnerable time. Sometimes people are dealing with pain. Sometimes people are dealing with chronic illnesses. Sometimes people are, dealing with all types of situations. And you kind of have, yes, I understand that, some people might showcase their frustration because of what they're going through and because of what their family members going through, and though they should not take it out on you, you have to understand that it's not a personal situation. It's just based off of what they're going through in the moment.
Yeah.
And so because of that, as a nurse, I think a nurse should tell themselves, you know, let me think about what this person is going through. They're not going through it easy. This is not a walk in the park, They're not here to have a picnic. They're in a situation where they're, in pain. They're in a chronic situation. They're having whatever crisis, even if it's a mental crisis. You know what I mean? So at the same time, despite I understand nurses may be going through difficult times with management and so on and so forth, having financial issues and so on, I think it's better to take it up more so with management than to release it on the patient, because the patient is already going through their own trauma. And you don't want to add trauma to trauma. You know what I mean? It's like putting salt in a wound. So
But when you say A, you have to say B too, because sometimes you might try to hide your feelings, especially when it comes to management. And management sometimes just do some things that as I said before, you have to wonder if they went to school, right? But the thing is, sometimes when you have like a very difficult, you have some difficult patients. I would not lie. You'd have some difficult patients that sometimes you just have to take a deep breath and go away. Because, as I said before, we have feelings too. And we, as Shanita would have said, we can't take things personal because people in pain, people react to pain differently. However, when you are in pain, pain is what the patient says it is, right? But I know sometimes behaviors can come out, but also the nurse might be in pain too. So I mean, there's never going to be a win-win situation, but try to make it at least 90-10, whereby you stay professional, you have a sense of self-control, and sometimes it's just easy for you to walk away. It's the easiest thing. So, yeah.
Another thing I wanted to add too is that, which I've heard my own mother say this already and stuff too, when she has been dealing with a situation. She back in the day she had a situation. I don't know if it was her tonsils were hurting or something, but she was saying, she kind of gave herself a diagnosis, and the nurse would say, oh, you don't, how you know you got this, how you this, but my thing is, yeah, you can't really give yourself a diagnosis, but the the patient is the expert at this point, because they, even though they don't have the scientific or the theory and so on and so, they didn't go to school, but you know your body best. You are the best expert because you know what you're going through, right? So you can tell, okay, I have this symptom, I have this symptom, I have this symptom, and obviously with Google and stuff, even though Google might not be necessarily accurate all the time, but you still have a idea, and so you have, as a nurse, as a doctor, you have to listen
to
the patient,
yeah,
because they know what is going on with them. They know what's going on with their body, and at the end of the day, they're the ones that are experiencing the situation, not you.
Right.
You can give your professional opinion, but at the end of the day, the patient is the one that's living with the condition, and that's just a by the way. I can go more into that when I do another video, about my own experience with the hospital, and my condition, or condition I had at the time, or whatever. But yeah, that's just a little piece I wanted to put in there, because I think that's super important to not downplay when a patient says that they have certain things going on with their body, because they're their best with expert opinion.
I agree.
Okay. The last question I have for you, Miss Nurse, is what advice would you give to others? Oh no, did I ask what your best experience was? I asked that, right? Oh, sorry. Okay, so the last question is, what advice would you give to others who want to become a nurse?
My number one advice is to make sure that you love your job. As I say time and time again, nursing is not a job that you could say, oh, I go and work, do what I gotta do, and go back home. It's not a job like that. It's a service.
Yeah.
It's a calling. I believe in my heart it's a calling from God, and we need to show love and compassion to these patients, our residents, wherever we work. Because sometimes these people don't have family, and we are all they have, and we have to show them the love and care that they need. Sometimes it's just a simple good morning that will make those patients day, and you will see they get better in one. Sometimes it's just a prayer. You have to pray for them. It makes you go above and beyond. So if you are not a compassionate person, do not go into nursing. I'm telling you so right now. Because you're going to need some form of compassion, you have to show care, you have to show love. So that's my number one advice.
Okay, well, thank you very much.
You're welcome. Although you took over the show.
I didn't really take over the show this time. That's the truth. But thank you for that information, and I hope that that would have helped someone who wants to join the career as a nurse, who wants to find out about the process of nursing coming to Canada as an international educated nurse. And
what I will do is in the description, I will put the CNO website so that you will have a better understanding and better research thing to see how to become a nurse in Ontario. I don't know for the other provinces, you will have to read up on that too, but definitely the CNO, and I would also give the link for NNES to start the application process.
Okay, so perfect. So thank you very much for watching our video.
Thank
and
you.
have a great night.
Please like, share, and subscribe to Sisterly Convos. Thank you guys. Good
Bye.
night.